uterine fibroids are the most common tumor in women. They can be frequent, as many as 50 to 60% of women may have them. Most of the time they're asymptomatic, meaning they don't cause any problems, but they can result in excessive bleeding, pain, pressure symptoms, decreased fertility. A fibroid is a benign, meaning non-cancerous tumor that grows in the uterus. It's a tumor of the muscle cells that make the uterus, and they can sometimes grow to be very, very large. Many women that have fibroids may never even know, okay? They may be completely asymptomatic, meaning that they're there, but they don't cause any issue. You don't feel them, they don't have pain, you don't have excessive bleeding, and over time they may regress with menopause. The patients that do have symptoms from fibroids can have very severe symptoms, and those symptoms can be severe to the point of requiring hospitalization due to excessive blood loss, a quality of life issue where you're waking up multiple times at night to go to the bathroom or having a lot of pain, feeling like you can't eat a whole lot because there's a lot of pressure in your stomach. The most frequent symptom that we encounter in patients with fibroids are going to be what's called menorrhagia. Menorrhagia is excessive bleeding, oftentimes secondary to fibroids. And menorrhagia has a somewhat loose definition. What we typically use with the OBGYNs that we collaborate with is a definition of bleeding that it impacts your quality of life. If it feels like your bleeding is excessive and difficult to manage, or otherwise causing other symptoms like lightheadedness or anemia or weakness, then those are symptoms to investigate. We offer a full clinical service for the evaluation of fibroids, and we collaborate with local OBGYNs in this process as well. And so that involves a clinical consultation to assess whether patients are having symptoms or fibroids or complications of fibroids, imaging workup for the fibroids so that we can assess how large they are and if they are amenable to minimally invasive treatment. Fibroid embolization is the treatment that we utilize to treat fibroids. And what we do is typically go into an artery or a blood vessel, most commonly in the wrist, but sometimes in the groin. And from there we navigate a catheter, which is a small plastic tube, through the blood vessels to find the blood vessels that supply the uterus and the fibroids. Once we're inside the correct blood vessel, we administer small beads. They're little particles that flow with the blood supply into the small branches that supply the tumors or the fibroids and decrease the blood supply to the uterus. That does not destroy the uterus or kill the uterus. There is still blood supply going there, but it does decrease the blood supply enough that we expect the fibroids to, one, stop bleeding if they're bleeding, and two, significantly reduce in size over time. Pregnancy is possible after uterine fibroid embolization. Pregnancy is not possible after a hysterectomy, and uterine fibroid embolization doesn't have the surgical intervention and incisions on the uterus that myomectomy, etc., can have and be complicated by. It's a long way of stating that it's a complex discussion. In patients that are desiring future pregnancy, it is absolutely worthwhile having a consultation regarding uterine fibroid embolization to see if it's the right option for you. On the right side of the image, I have a patient who was referred for fibroid-related bleeding and pain. And I have an image of her CAT scan here. This is her belly button, this is her spine, her head is up this way, and this is her pubic bone. Her legs are down this way. And this large structure right here is her uterus, which is about the size of a second trimester pregnancy, almost reaching up to the level of her belly button. Okay? A normal uterus, if you follow my mouse, is going to be around this size down here. Okay? What we can notice is that the uterus and the fibroids are pushing up against the spine, explaining her back pain. It is compressing the bladder, which is down here. The bladder has no room to fill, so she was going to the bathroom very frequently, having lots of urgency symptoms, waking up at night to urinate, which was very uncomfortable for her. And then also, all of the brighter areas of the uterus are enhancement or blood supply that was resulting in excessive bleeding. So we brought this patient for angiography and embolization. On the left side here is the initial image. We have a catheter in the right groin that goes into the blood vessels to the uterus. We inject contrast, which allows us to follow which way the blood flow is going, and we can see that we can see the enlarged uterus, we can see the fibroid, and we have these splotchy areas of enhancement that show that the blood supply is getting all the way to the fibroids in the uterus. After treatment, which is now shown on the right side, we can see that our catheter is in the same place. We're injecting that contrast and watching with the x-ray, and I can see already that I see reflux or blood going to other blood vessels, not into the uterus. And as we play this out forward, we can see that some of the vessels in the uterus are still open, but all of those splotchy areas of enhancement that we're seeing before are gone. And it's that absence of blood supply that over time causes the fibroids to essentially, 1, stop growing, and 2, shrink. It doesn't require general anesthesia, so we don't have to put you to sleep. We can do this with just some moderate sedation. Patients come in, they get the procedure, which is usually done in less than an hour, and they go home the same day. Unlike a hysterectomy or other surgical procedure, there's no incision to recover from, there's no stitches, there's no prolonged inactive period. Overall, the literature shows that the recovery period post-fibroid embolization is significantly less than any surgical intervention, and for appropriately selected fibroids, the efficacy or the effectiveness of the procedure is the same.